I am Dr.RUkmani Choudhary, and in this video I'll be talking about amyloidosis. So amyloidosis is a rare disease, is a rare condition, and it is a group of disease, means there are several diseases related in this amyloidosis. Amyloid is a kind of protein and it is an abnormal protein. So once it is get deposited in your body, then this is called amyloidosis, and it can deposited anywhere in your body like your skin, your heart, your lungs, your kidney. So wherever it gets deposited, the name turns. If it is in the skin, then it is called cutaneous amyloidosis. If it is in the lungs, then it is called pulmonary, and if it is in the heart, then it is called cardiac. So how the terms change with the organ affected. So this is a kind of rare disease, but yes, it is seen. There are complications if you don't get it treated earlier. So let's talk about the risk factors of the disease. What are the risk factors of the disease and who are prone to have this problem? See, amyloidosis, though it is a rare condition, but yet it runs in the family. So one factor is genetical factor, familial factor. So it runs in the family. And number two is male gender. Yes, if we talk about the gender part, male are more prone to have this problem. And senility. With the age you are prone after 60, yes, there are chances that it is seen after 60. So, and yes, at times you have other organ affected. If you are a kidney patient, you are prone to have this problem. Can be, see, these are the abnormal protein, right? And it can deposited anywhere in your body, and wherever it deposited, we already told that this is called, the name is given to that particular organ affected. So this can be systemic, means your whole body is affected, and this can be localized, means only a particular organ can get affected. Types of the amyloidosis type. So number one and very common is AL, that chain amyloidosis. So this is a kind of type chain of that are produced or overproduced. So then it turns into amyloid, and these are called abnormal protein, and this is how it calls amyloidosis. And earlier it was called like primary amyloidosis. Mean the disease itself is causing the overproduction of the abnormal protein. And moving on, the second is called AA amyloidosis, and it is called autoimmune amyloidosis and also secondary amyloidosis. And this develops after having certain illness, having other disease, and from that disease you are having these abnormal protein depositions. Like after the tuberculosis, you can develop these infection, these abnormal protein depositions. After rheumatoid arthritis, you can develop these abnormal depositions. Even after tuberculosis, after rheumatoid arthritis and inflammatory bowel syndrome, after that you can develop these abnormal protein depositions. So these are the autoimmune disorder. If you had these, then in these cases you can develop these abnormal. And moving on, the third one, that is familial, genetical. So yet it is seen that it runs in the family, but due to some genetic changes or some mutations, it is found. So yes, again there is a familial amyloidosis is seen. Beta cells amyloidosis, or it is called dialysis. Dialysis, as the name suggests, if you are a kidney patient and you are having a kidney disease from a longer duration and you are on the dialysis, then these abnormal protein are formed, amyloid. So it is called dialysis amyloidosis. Senile amyloidosis, senile as the name suggests, due to age. So with the aging, if you develop these abnormal protein, then this is called senile. Once again, these proteins are abnormal protein and they can get deposited anywhere in the body, right? So this is how their name changed with the type of, with the abnormal structure of. Or symptoms part. See, these abnormal proteins can deposit it anywhere, and that affected organ gives you the symptom, right? So if your heart is affected, then you have heart related symptom, you have lightheadedness, you have blood circulation related issues, like you have at time low blood pressure, you have palpitations. So these are heart related issues. If the skin is affected, then you have skin related issues, and if your liver is affected, you have loss of appetite, nausea, vomiting tendency. Sign is affected, then you have diarrhea, bloatedness. The symptoms can be minor, moderate, and severe according to the intensity of the organ, of that affected organ, and intensity of the disease. If you have kidney related issues, means your kidney is affected, then you have swelling in the legs. And if you have nerve related issues, then you can have the tingling, numbness sensation. So it depends always on the affected organ, that symptom you have related with that organ. Part, the diagnosis part. Diagnosis is usually made by testing your blood are done and your urine tests are done, and the confirmative, the definitive diagnosis is made by doing biopsies. The affected organs tissue sample is taken and that is studied. So that gives you the clarification, the definitive diagnosis is made on that, and ECG can be done to ruling out the heart disease. And the stain is done, so a red stain for the amyloid purpose. So this is again definitive diagnosis. Treatment is based on the lifestyle modification, the critical one, rare one, and at times it is a hereditary. So it is not curable, but it is treatable. There are some lifestyle modification, some dietary changes, some fluid intake modifications, and you can have low sodium diet. So just cut down your sodium in the diet and have fluid in your diet, and movements are supposed to be done, because this is a disease in which your skin is also affected, so you are supposed to be active. Certain rest are supposed to be taken for the proper healing purpose, for take and salt restriction. So these are some dietary changes. So hopefully this video can help you. If you find this video knowledgeable, informative, please like and share, and don't forget to subscribe my channel and press the bell icon to get notified. This is again a patient's request topic, amyloidosis. So hopefully I covered up, and the treatment part, homeopathic treatment part, will this coming videos. So thank you for watching. Thank you so much. Thank you for your support. Keep watching. Thank you.